Hi, I'm Julie Donnelly from Julstro Muscular Therapy Center. I've developed the unique Julstro techniques to be a self-treatment system to release the muscle spasms caused by repetitive strain injuries. In this session of pain-free living, we're going to talk about a muscle in the thumb that can give symptoms that are very, very similar to arthritis, and also just generalized pain and weakness in the hand. The muscle we're talking about is called opponens pollicis. The opponens pollicis originates on the flexor retinaculum, which is the bridge to the carpal tunnel and is actually a part of carpal tunnel syndrome. But the muscle originates here, it comes up and it inserts then onto the base of your thumb. When this muscle contracts normally, it brings your thumb into the middle of your hand. A movement you've done millions and millions of times every year. Every time you pull your thumb in, it's the opponens pollicis contracting. Because of the joint is set up, it's called a saddle joint, you can't stretch that muscle. I mean, there's just no way of stretching it. The muscle gets shorter and shorter and shorter. As it does, it's either pulling on this flexor retinaculum and causing pressure on the median nerve, giving you numbness in these three fingers, or it's pulling on the base of your thumb and can actually cause your thumb to go in like this and then not be able to come back out again. I had a client named Marian who had tension in both of both of her hands. She came in and she said to me, "Well, Julie, they tell me that I have arthritis in both of my thumbs." I said, "Well, that's very interesting." I said, "And why?" So she said, "Well, they didn't do any test, but," she said, "look at my thumbs." And they were both like this. She said, "I can't bring them out." She said, "When I try to bring them out, they hurt. You could feel that they even felt a little bit warm. And it was certainly painful. And when they had done an x-ray, they did see that there was some bony growth on the thumb." So she said, "The problem is the drugs that they're giving me for the arthritis scare me so much, these potential side effects, that I've decided I'm going to live with the arthritis. I'd rather live with the pain than be on those drugs." So I said, "Well, let's take a look at the muscle, the opponens pollicis muscle." So when I pressed on it, it hurt, and I taught her what to do to self-treat it. Well, Marian is from a family that really has very big Easter celebration, and she was the matriarch of the family, so she was having all these family coming over, and she was cooking and cleaning and preparing the way you do when you're having family come over. She comes in a week later, and she said to me, "Well, I don't have arthritis." I said, "That's very nice." I said, "How do you know?" So she told me how she had been doing the treatments that I taught her all week, and then she forgot about it because she had to start preparing for the family to come. And after they had left, she was sitting on her sofa and she was thinking about the weekend and how lovely it had been. And then she realized she had been peeling vegetables and chopping vegetables and cooking and lifting frying pans and cleaning and doing everything that you do when you're having a house full of company. And her thumbs were just fine. She would have been taking those drugs and they wouldn't have worked because that wasn't her problem, which would have led her to take stronger medications because the other ones weren't working, and it would have kept going and going until the odds are at some point she would have had some of those potentially bad side effects. And all it was the muscle of her hand, the opponens pollicis. You can treat it real easily. It's so simple. If you'd like more information, come to my website, julstro.com. And I also teach self-treatment clinics all over the country. I hope to meet you at one of them. Thank you.